I'm just going to go ahead and get started, but don't feel in a rush. This is the title, Everything You Wanted to Know About Colonoscopy, but Were Afraid to Ask. My claim to fame is I'm married to that wonderful woman right there, and 6 great kids. Now, like Dr. Brisbane, I'm a general surgeon, and people say, well, what are general surgeons? What's their training? We do basically just about everything. Some people think that we should be called master surgeons because we have training in a lot of different things. We do scopes, upper lower scopes, cancer surgery, breast, colon, gallbladders, hernias, apneas, skin cancers, traumas, you name it, we do it. My background, I went to School of the Ozarks in southern Missouri for college, trained in Columbia just on the road, did my medical school and my residency there, lived here for 18 years like Dennis said, and I enjoy very much doing mission trips. I've done one with Dr. Kelly down in Haiti, and this is just one of the mission trips to Uganda a few years back. So what I'm going to talk about tonight is colonoscopy. Who, what, where, when, why, and how. Who? You, loved one. In fact, I'll be perfectly honest, my wife set hers up with Dr. Brisbane. She said, I want you to get yours, so I scheduled mine just today. And if you want, I've got some of these handouts in the back of the room. It's just because I love you, I have scheduled colonoscopy for you. So if you want something, you know, if it's a birthday, anniversary, lots of good occasions. It says you can. So what are we talking about? We're talking about the colon. It's the organ right here. We do not see the small intestine or anything else in the belly. We just look at the colon because that's where the high incidence of cancer occurs. We're looking for, you know, diverticular little pockets, air pockets. Polyps or growths that change in cancer, and then obviously cancer is what we're trying to catch early or prevent. And where do we do it? Fitzgibbon Hospital, same-day surgery center. This is how many we do. We've done in the last 3 years, so we do a lot, 1,000 a year. As opposed to, this is in Belize, the facilities are a little bit better here, quite a bit better here at Fitzgibbon Hospital. And when do you start? Start at age 50, every 10 years, that's kind of standard. If you're, you know, what age you stop? Well, the old recommendations are you go to your age 85. New recommendations are starting to say, well, 75. Some of the recommendations say, well, if you plan on living 10 years longer, you know, if you've got somebody that's 60 that's in really poor health, you probably don't want to do it. If you have somebody that's 85 and they're in great health and you expect them to live 10 more years, then you probably want to go ahead and do it. And another one is if you have a family history of colon cancer, or if you have personal history of colon polyps, then you want to go every 5 years, okay? If you have a relative that had cancer at a young age, you want to start 10 years younger than when they were diagnosed. So if they were diagnosed at 50, you want to start your screening at 40. If I'm talking too fast, slow me down. And if you, especially if you have symptoms, what kind of symptoms you look for? Okay, blood, that's an obvious one. Your change in stool caliber, okay? Should have a nice size bowel movement. If it starts getting narrower, we might have something blocking the exit. If you have, I've always been constipated all my life. Now the last 6 months I've had diarrhea and it just won't stop. Might get to check out weight loss. Weight loss is usually pretty late. If somebody's losing weight, it's pretty advanced. And then sometimes you lose blood, you get a blood test at the doctor's office that shows you're anemic, and that might be an indication. This is a polyp, and if you have a polyp found on colonoscopy, and you want to repeat that colonoscopy in 1 to 3 years. Just make sure it hasn't grown back. And so, why do we do colonoscopies? Okay, across the United States, almost 150,000 cases of colon cancer diagnosed per year, almost 50,000 die. What does that mean for Saline County? We've got a population of 22,000. Okay, that means 11 people in Saline County are diagnosed every year, and 4 of those people will die. And colonoscopy decreases risk. And that's just what colon cancer looks like when you see it on a colonoscopy. So how? This is a trip to Belize. My wife ran this. It's a day trip. They load everything on top of the truck, and then they go out to some village and they give medical care, but the road is flooded. So how do you get across that flooded road? Now, how do you prepare for a colonoscopy? Okay. It used to be an ounce and a half. Easy. There's a very, 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 very small risk of kidney damage with that prep, so they took it off the market basically. unless you're just perfectly healthy and 12 years of age. So that's basically off the market. You've got the gallon, go lightly, half gallon, half lightly, and then you've got pills. Now with the pills, what is it, 60? No, how many pills? 64 pills?
32 pills.
32 pills, thank you.
I think it's four at a time.
And 8 ounces of water, so you end up drinking a half gallon of water with the pills. The thing is, this one's cheap, this one's more expensive, this one's very expensive. So it depends on whether your insurance company pays for it also, which one you want. So,
on average, my nurse tells me when she calls to ask that very question, it ranges from 50 to 80 to I've seen a little over $100 difference.
yeah. And
Pills may be more expensive.
And it depends whether your insurance company.
Correct. That's the variable.
How? Sedation. You would sleep. Yeah. So we start an IV, we give you medicine, you drift off to sleep, we do the procedure, you take a nap. Now, how do you position yourself? Well, some people think we're, going to make you get in a contorted position, but what we do is, and now this I found, I just threw it up there because it's for lower endoscopy. It's a little grainy, but she's laying on the right side. That's wrong. We have you lay on your left side. It's a little technicality, but so you just lay on your left side, you take a nap, and then you drift off to sleep. How long does it take? 30 minutes, as a rule. Then, sorry. Hey Frank, how was your colonoscopy? In and out. So it's fairly quick. Doesn't take real long. And how long to recover? We'd like to watch you for about 30 minutes after the procedure. Make sure you wake up, not having a lot of pain, not having any complications. Don't want you to drive home, have somebody drive you home just because you've had sedation. Don't want you to find out that you don't have colon cancer and wreck on the way home. Good thing. Okay, how? The risk, okay. The one that most people complain about is the preparation. By and probably 10 to 1. It's all okay except for the prep. I hate taking the prep. Can you make better prep? Well, the procedure, I put discomfort. The procedure is more than discomfort. It's painful. Some people would say torture. That's why we give sedation, so you don't feel it, so you can sleep the rest through it. It's a good test, but it's not perfect. There is a chance of missing something, especially if you're not good and cleaned out and it's covered up with poop and you just don't see it. So it's a good test, but it's not a perfect test. So if you've had a good exam a year ago and you start passing blood, you might want to think about having it again. Again, I don't want to scare you. It's very rare that you miss things, but you can, just because you don't see it. Sometimes the colon is just too long or there's too many twists or turns and you can't get all the way around, see the whole colon, so it's an incomplete exam. Risk of bleeding or perforation requiring major surgery to fix. Now, perforation requires major surgery to fix most of the time. That risk is about 1 in 1,000. So it is a test with a risk. You have to say, is the benefit worth that risk? Well, and that's why they do the large studies. The American Cancer Society comes out with recommendations. And this is what colon cancer looks like, again, on a colonoscopy. What are the benefits of colonoscopy? You get to take a look. Okay. You get to take samples if there's a big growth in there. Is it cancer? Most likely is, but you take samples to see if it is indeed cancer. You can't take out big things through the scope for 2 reasons. One is because the scope isn't big enough, but the bowel wall is thin. And if you take out a big thing, you burn a hole or you poke a hole, so you don't do that. But you do get to remove small growths. So if the growth isn't too big, actually you can take out some pretty big growths if they're on a stalk, and then you can run tests on that. And sometimes even if there's cancer in there, that's a cure. That's what you need to do. So you get to remove small growths before they turn into cancer, or sometimes you can remove larger growths, or you can have just peace of mind. Okay, I don't have it. My dad had it. I was nervous about it. I was worried about it. I was asleep over it. I feel better. Peace of mind. I can sleep. This is just in a nutshell. I'll just read it. First, you drink a gallon of somewhat nasty liquid. This is supposed to clean your system out. It works, flush. The next day, they give you drugs that block the discomfort and affect your mental state. Hey man, my colon is like on TV. And then the recovery period, however, is quite pleasant. And you get a snap. And this is what people say. This is the best. That's what that's the best nap I've ever had. This wasn't so bad. The worst part was the prep.